Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you have requested. The area of interest has been mentioned as you can see on the screen as well. This is the 3D rendering of the lower left aspect. We've got a grossly carious wisdom tooth. We've got a class 5 lesion in the 7 and we've got a filled lesion in the 6 as well. When we move towards the pseudo panoramic view, let's start with the 6 so that we have a better understanding. So this is the transaxial view of the lower left 6. As you can see, we've got the lesion is still pretty much intact right here, and it's also causing a leakage towards the pulp here. So this is a tooth that can definitely be very much irritated. This is the restoration, but there definitely seems to be some form of residual cavities. When we move towards the 7, we've got a class 5 lesion developing right here, which could be the cause of pain. We don't see a swelling or radiolucency in the jaw. And then moving to the lower left 8, you can see that the lower left 8 is grossly carious, very close to the nerve right here, which would also be a significant factor for the pain. The lower left 8 is quite significantly far away from the inferior alveolar nerve, and hence the chances of nerve damage at the point time of extraction is not going to be an issue. If we move you to the axial view or the top to bottom view, you will be able to see that the lower left 8 is quite close to the lingual cortical plate, and you can see that it should be kept in mind that during the extraction lingual forces should be minimized. This is the axial view. This is the lower left 8. As you can see, it's very closely embedded to the lingual cortical plate but significantly far away from the nerve. This is the upper left 6. As you can see, we've got a major periapical radiolucency. Short obturation, MB2 has been missed, and a radiolucency. Then we move towards the parietal canal. The parietal is also short obturation, but no radiolucency. And then we've got the distobuccal is also short, but no radiolucencies as such can be seen. This could also be the cause of pain. The upper left first molar. This is the upper right area. We've got two endodontically treated teeth. This is the upper right 5. As you can see, the parietal canal has been missed with a radiolucency causing odontogenic sinusitis as well. The buccal is done. The parietal has been missed and has some form of blockage as well. This is the upper right first molar. Again, single canal has been obturated. We have a major periapical radiolucency. Moving with to the parietal, again a radiolucency in the parietal. The parietal is sorry, my apologies. This is the parietal canal. Again, the parietal also has a radiolucency, and furcation has radiolucency, and then we've got the distobuccal as well, which shows some form of medial widening. This is the axial view of the one last part that I can show you on the transaxial is the lower right 6. Poor endodontic treatment done here. Radiolucency can be seen. The distal canal is short in obturation. Radiolucency is present, and then we've got the mesial root, and the mesial root also shows a radiolucency with a buccal bone loss, as you can see on this aspect as well. There we go. So extreme buccal bone loss of the distal. The axial view will show us if there is any fractures in the teeth. So the lower right 6 does not show any significant fracture lines, but we do see a line here on the distal. There we go. And we do see a line here on the mesial. So there is definitely a risk for fracture in the mesial root right here, and there is a furcation involvement which indicates that there is an infection in the furcation as well. Thank you very much.